This is Oliver Portman from Snow Companies. I know you expected Brenda here today. She sends her apologies. She's ill today. So yeah, we wish her a speedy recovery. But the guest today is going to more than make up for Brenda's absence. I'm speaking to Gerry. She's an amazing woman. She has a huge platform and is really a thought leader from the patient perspective on pH. So hi, Gerry. How's it going?
Hi. Good. How are you?
Good to talk to you. Welcome to the show. I'm really excited to talk to you today. So, Gerry, you have pH. You were diagnosed in 2018. What was your initial reaction to getting the diagnosis?
It was shock, as anybody would expect, especially being as young as I was when I was diagnosed. It was just one of those things where it was like, this can't possibly be happening to me. Like, you hear all of these stories about people that get diagnosed with like stage 4 cancer and like all of these terrible things. But like at the time, I was probably obviously my youngest and also my healthiest. I didn't expect it. And I think shock was probably the best way to describe it. And then probably followed by like a lot of confusion and anger.
Right. So did you have any idea what this is that you're being diagnosed with here?
No, actually, when they told me what I was diagnosed with, I was actually confused because I'd never heard of it before. But before they told me the pulmonary hypertension diagnosis, they actually told me that I was in congestive heart failure. So I suffer from pulmonary hypertension as a primary condition and then congestive heart failure as a secondary condition. What sent me to the hospital was the heart failure. So I guess I wasn't like super healthy, but like I felt what at the time was normal to me. So like I had been living with it for, a handful of months at that point, and I had no idea. So when they diagnosed me with pulmonary hypertension, it was after they'd already diagnosed me with heart failure. So it was just a lot at one time. And then they also told me that like if I didn't start treatment at the time, that I probably only had like a year or two to live.
That's incredible. But so you say, so how does, tell us a bit, what did life look like for you at that point in time when you say you were at your healthiest and then this just kind of came into your world? How can we imagine someone with a heart condition, like a serious one like that, being at the healthiest?
It was weird. So like I had just come off having my twin boys. So I have twin boys now, they're 3.5, but at the time they were only about a year old. So like before I was pregnant, my husband and I were competing in CrossFit competitions. I was playing competitive soccer. Like I was pretty healthy. And then I got pregnant, and like pregnancy itself is hard on the body, but like I didn't feel unhealthy. And it was kind of crazy, like I started feeling like pretty winded and pretty tired, but like at the time it wasn't any different than what postpartum bodies look like. Like I was sleeping a lot, but I had kids that weren't sleeping through the night, and I was really tired, but I was taking care of 2 other human beings at the time. Yeah. And then my husband was gone. So like, obviously I was very tired. I was short of breath, but we had moved to Colorado from sea level. So like being short of breath is altitude, you know what I mean? So there was just a lot of like contributing factors to like what conspired later. But like, it was like one of those things where it was like, there were so many things working against me that like by the time I really started to notice that something was wrong, it was already too far. Like I am very good at brushing off my own symptoms and just being like, oh, it's fine and I'm fine and that kind of stuff. So at the time I just, kind of brushed it off like it wasn't that really big of a deal. And then all of a sudden it wasn't a big deal, and then it was a really big deal. Like it was,
Yeah. Is there like a prevailing theory in at least in your case of sort of what might have brought it on?
So I am diagnosed with idiopathic pulmonary arterial hypertension, and idiopathic meaning that they don't know what caused it. But a lot of women in their, early 20s and 30s that get diagnosed with pulmonary hypertension end up having pregnancy-induced pulmonary hypertension. Most of the time, they can, sort of catch it as it's happening during pregnancy. But with my case, having already so much strain on my body with having twins, I think it just kind of slipped through the cracks. But by the time I was diagnosed and by the time the symptoms started showing up, the boys were already a year old. And medically, especially in the medical journals that I'm in, they were not able to say that pulmonary hypertension was induced during pregnancy because it had been a year. So they can guess probably, but like they can't really say for sure.
Yeah. I read that altitude, so moving might have also been maybe contributing. Who knows? Interesting. Yeah. So you mentioned competitive soccer. Is that so? That's not a thing anymore, I would think.
No, I wish. I really miss soccer. I think about soccer all the time. I sometimes on my really good days, I'm like, I could do that again.
Yeah.
But then I also haven't run or worked out in years at this point. So I don't know if my body is actually trained for that. I do know people with pulmonary hypertension that run 5Ks and run 10Ks and are able to do those things on the correct treatment. But for me, it's just, I have kids. I just don't have the time to play soccer at this point. I really wish I could. I don't know if my body would let me, but I probably would push it really hard. I'm a pusher, so I probably would push it.
Yeah. Well, is there sort of a recommended sort of middle ground, sort of what you can do without much risk to your body?
Well, they tell you, for cardiovascular health, you're supposed to, do cardio and like run and do all those things. But I think that having twins is probably really good for my heart rate anyway. And having to chase them around and being being anxious all the time that somebody's going to hurt themselves. My husband is also in the military and he flies helicopters. So I think I just stay at like a really heightened anxiety level. So my blood pressure is always, up and down anyway. So I think they probably would recommend that I do more physical activity, but I'm doing a lot of physical activity as it is.
Okay. Yeah. Just by default. Yeah.
Yeah.
Yeah. So what has changed in your life? What changes did you have to make to your day to day other than giving up competitive sports?
Like day to day is a little different for me specifically because my treatment is different than other people's treatments, but I am on a pump 24/7, which also means that I have to deal with things that normal people don't have to deal with. So like I have a pump that runs to like a site in my body. Right now it's in my arm. And I self-inject at home, which is crazy in itself. But then I have to worry about like sweat can mess my side up, or bumping it can mess my side up, which doesn't, allude well to sports. And like, I would like to work out, but like sometimes, like I live in Florida, so like it's really hot here and it's, I'm sweaty all the time anyway. And then adding the humidity to that makes me nervous about my sight falling off, because it can do that. Like it could just fall out and then I would have to put a new one in. So like the day-to-day life is, I think we've slowed down a lot. I have slowed down a lot. I take the boys, we try to get out of the house every day. We try to do all these things, but like I have to be conscious of like things that I can do that will not affect my sight, things that I can do that are not going to affect my pump. All of those like small things, but it also affects like just normal things like being able to shower, because like I have a site that I have to keep on all the time. So I have to cover it. I have to be able to make sure that it doesn't get wet. So like showering is hard. Washing my hair is hard. I've got long hair. Those things. And then like I also have to, adjust my schedule around my side effects for my medicine. So like I take a water pill every day because I'm in heart failure to try and keep all the water off. So like I have to make sure that if we go to the park that it has a bathroom. Like, you know what I mean? Like they're just like very small, fine-tuned things that we have to pay attention to. But I also change my pump medicine every 3 days. So like I have to make sure we're home in time. I can change my medicine. And then I take oral medication at night, and I have to make sure that I'm home in time to take my oral medicine. Like just like very small things that end up adding to be a lot of big things.
It's sounds pretty huge to me.
Yeah, I feel like I don't really like to overthink it.
Yeah.
But it definitely affects the day to day. It's just now we've been doing it for so long that it's kind of second nature, but also there are some days where it's just really annoying.
Yeah, no, I understand. Is there anything that's scary? Like when you say site, is that the same thing as a port, or is that technically a different thing?
So it kind of looks like it's exactly like an insulin pump. The pump that I use is a repurposed insulin pump. It is delivered the same method that people with insulin do, except the way it is delivered to me is instead of it being like a few hours, people with insulin can like inject and then leave it on for a few hours and then take it out. I leave it in as long as I can. So I always have it on.
Okay. And sort of the a risk of infection, is that ever a thing there, or can that be easily mitigated?
So with the subcutaneous version that I'm on, it is a lower risk for infection. Originally, when I was diagnosed, I was put on an IV, which was a central line port to my heart. And that actually was infected twice. And I almost was septic one time before they had to pull it. It was very scary. And the risk for infection with an IV is higher than it is for the subcutaneous. With this one, it's more of like a skin infection, like a topical skin infection, than it is like a septic blood infection.
Yeah. Oh, that must have been real scary. Well, yeah. I'm glad you were able to mitigate all those issues. So you have a huge network. You're a trailblazer within the PH community. You know anybody who's anybody within PH. So question you would know, what are the things that you think the community is craving that, you know, the medical society or us or, you know, whoever, like that's just not being provided by, you know, life sciences, and where are the gaps that we still need to fill?
For pulmonary hypertension itself, because it's such a rare condition, it's really hard. There are a lot of people out there that are, you know, trying to do clinical trials, and there are tons of companies out there that are making new equipment. But for example, my pump is a repurposed insulin pump, and they just came out with a pump specifically for pulmonary hypertension, but they've never had one that was a subcutaneous version like the one we use. So like they just came out with that. Like I think it came out in January, but it's the first one to be specifically designed for us. So like there's a lot of gaps in like research and stuff, but I think that it's getting better. It's just that because the condition is so rare, it's so difficult to get an accurate diagnosis. And then it's also difficult for people to like understand that, you know, patients that are diagnosed are often misdiagnosed for a really long time. And by the time they are diagnosed, their conditions are so far along because doctors that are diagnosing these conditions don't understand the difference in pulmonary hypertension and pulmonary arterial hypertension. And some doctors will just call it hypertension, but hypertension itself is such a different beast than pulmonary hypertension. And it comes with its own set of complications, right? So like, it's just one of those things where like education for a rare condition is lacking. And I think that makes it really hard. And then there's also the case where, you know, patients like myself, that are just diagnosed and are just, learning about this condition. There's not a lot of patients out there that are sharing their story, which is kind of, how I started all of this to begin with, was that like I was out, of the hospital. I was in the hospital and I was sitting in my hospital bed looking for people like me online. And there weren't a lot of them. And like, even though pulmonary hypertension affects women, young women, a lot, it's just not common for those women to feel empowered enough to share their stories. And that's hard for patients that are recently diagnosed, because you're always looking for that beacon of light or like that hope, right? And like with not having people out there sharing their stories, or like getting out there and, trying to make a difference in education with doctors and that kind of stuff, means that like there are patients that are, just suffering by themselves. And that, I feel like that is something that has been lacking, where, I stepped up and was just like, I guess if somebody's got to do it, it might as well be me.
Well, thank you for doing that. I mean, it's really important that there are people, who have it takes courage, right? To stand up there and say, this is me, this is my life. Here's my story, do with it as you will. And I think that's so important for other people to know that they're not alone. You also made a really good point there about, how it's important to get an accurate diagnosis quickly, so that disease doesn't progress too much, or that you get actually on the right treatment, rather than something that could, for all intents and purposes, exacerbate the problem. That's very, very common in many rare diseases. So thank you for being out there and sharing your story, raising a little bit of awareness, so that maybe people listening to this, watching this, might have top of mind, oh, this could actually be PAH, or a different form of PH, or it might not be any of those, but, just to kind of have that in their minds, that that's a possibility. Yeah. So being chronically ill, what does it mean to you, or what kind of advice would you give to others who live with PAH or other forms of PH?
I think my biggest word of advice would be that sharing your story really matters. I get people all the time that will reach out and say that they have not seen people that look like them online sharing their stories, or people that will contact me and say that they're taking care of somebody with PH and not know what they're going through because they're not able to articulate that. So it's just really nice my advice is that if you were to share your story, somebody out there is looking for that story. And people don't always expect that their stories matter. So finding out that there were so many people looking for a story like mine was really empowering. And it ends up making a bigger difference, I think, than I realized it was going to at the beginning.
Thank you. So your website is gerrylangan.com. So Gerry spelled with a G, GERRYLANGAN.com. You can find her there. And if you want to get in touch with us, Snow Companies, obviously snowcompanies.com, snow-companies.com, or patientambassador.com if you want to sign up. So Gerry, thank you so much for taking your time today. Is there any closing words you would like to share with the community?
Yes. There's one more thing. So I have been talking a lot recently to patients who do not understand that they are able to look for second opinions. That is something that's really interesting to me. Patients who are looking to get diagnosed, who are having symptoms that are not like that doctors are brushing off, look for that second opinion. That second opinion is so important. And sometimes that's the biggest difference is like finding a doctor that really appreciates you and listens to you and empathizes with you, because having to find a second opinion can be scary, but there are a lot of doctors out there that are not going to take you seriously the first couple of times, especially if you're young, especially if you have an invisible illness or a rare condition like I do. Looking for that second opinion, you have that right as a patient, and you have the right to good treatment. So that is my closing.
I fully agree. Yes, yes. Stand up for what you need, and don't be shy. Stand up for it and say, yes, I need this. Please, someone take this serious. All right. Well, thank you, Gerry. It was a pleasure to talk to you today. And yeah, well, all the best. We got a little bit of a glimpse of the twins, not visually, but acoustically. So they sound adorable. So thank you. Thank you for sharing your story today.
Thank you for having me.
All right. Have a good one. Bye.
Bye.